Hello and welcome. We take medicines to get better, right? We trust them to heal us. But what happens when they actually cause harm? Today, we're going to dive into the hidden world of adverse drug reactions, a place of unintended and sometimes pretty shocking consequences. And it all starts with some very strange names. First on the list, gray baby syndrome. And yep, you heard that correctly. It's a really rare but incredibly severe reaction that can happen in newborns who are given the antibiotic chloropenicol.
And then you've got this one, red man syndrome. This is a reaction to the powerful antibiotic vancomycin, and it causes this intense flushing rash all across the face, neck, and upper body.
And finally, there's the incredibly serious Stevens-Johnson syndrome. This is a severe, and I mean severe, skin reaction that can be set off by a bunch of different medications, from certain antibiotics to anti-seizure drugs.
So, a gray baby, a red man, and this terrifying skin condition. What on earth could they possibly have in common? Well, they're all powerful examples of a really critical concept in medicine, adverse drug reactions.
Okay, so to really unpack this, we need to get on the same page. Let's define what we're actually talking about when we say a medicine is causing harm.
And this definition is absolutely key. An adverse drug reaction, or ADR, is not an overdose. It's a harmful effect that happens at a normal, regular dose. You're taking the medicine exactly as you're supposed to, but it's doing something unwanted, something unexpected.
Now here's the thing. Not all of these bad reactions are created equal. Pharmacologists basically split them into two main categories, and once you understand the difference, it all starts to make a lot more sense.
So on one side, you have type A reactions. The A stands for augmented. Think of these as predictable. They're basically a known effect of the drug, just a bit too much of it. And it's usually related to how high the dose is. These are what we often just call side effects, and they actually make up about 80% of all ADRs. But then you've got type B. The B stands for bizarre. These are the wild cards. They're totally unpredictable, they have nothing to do with the dose, and they're often caused by some kind of weird genetic or immune response. They're way less common, but they can be much, much more severe.
And what's so fascinating is that a single drug can cause both types of reactions. Take a look at warfarin, the blood thinner. It's predictable, type A reaction, bleeding. That makes sense, right? But it can also cause a really bizarre, unpredictable type B reaction called breast necrosis. It just goes to show you how complex these interactions between a drug and a human body can be.
To really understand why we track these reactions so obsessively today, we have to look back. We have to talk about one of the absolute darkest chapters in the history of medicine, a tragedy that literally forced us to create the drug safety systems we now depend on.
And the field that was born from that fire is called pharmacovigilance. It's the whole science of watching for these bad reactions after a drug is already out on the market. But it took an almost unimaginable catastrophe to make this a global priority and completely change how we regulate medicine forever.
And that catastrophe, it really comes down to this one horrifying number: 10,000. That's the estimated number of babies born around the world with devastating birth defects. That was the human price of a single unmonitored adverse drug reaction.
The timeline is just chilling. In 1958, thalidomide hit the market as a simple sedative. Soon, doctors realized it worked wonders for morning sickness in pregnant women, and it even became an over-the-counter drug. But by 1961, the awful connection was made. There was a sudden, shocking spike in babies being born with phocomelia, a condition where their limbs were severely shortened or even missing. In just a few short years, the damage had been done.
Okay, so let's shift gears for a second. You hear people say this all the time, right? Oh, I'm allergic to that drug. But in the world of pharmacology, the word allergy means something very, very specific. So let's clear this up.
So here it is, the bottom line. A true drug allergy isn't just any bad reaction. It's specifically a reaction caused by your immune system going haywire. A lot of those unpredictable, bizarre type B reactions are allergies, but it's just so important to remember that not every adverse reaction is an allergy.
And when we are talking about true allergies, they're generally broken down into these four types. Type I is that immediate, life-threatening anaphylactic shock that some people get from penicillin. Types 2 and 3 are a bit more complicated. They involve different parts of the immune system attacking your own cells. And then type 4 is that delayed reaction, kind of like the itchy rash you might get from a skin cream.
And this right here,
This is a perfect illustration of another cause for those unpredictable type B reactions. See, sometimes the problem isn't your immune system at all. It's your genes. This shows what happens in someone with a genetic condition called G6PD deficiency. Their body just can't process certain drugs correctly, and when they take one, their red blood cells literally start to self-destruct. It's a textbook example of a non-allergic but still incredibly severe type B reaction.
Okay, so after all of that, you might be wondering, what does this mean for me? Well, it turns out you play an absolutely vital role in your own drug safety. This isn't just for the experts.
The single most important thing you can do is give your doctors a complete, totally honest drug history. And I mean everything. It's not just your prescriptions, it's the over-the-counter painkiller you take for headaches, the vitamins and supplements you take every morning, any herbal remedies, even things you might not want to talk about. All of it matters, because all of it can interact and potentially lead to an adverse reaction.
And you know, that really brings us to the central question of it all. Every single medicine is a balancing act, isn't it? It's a trade-off between its incredible promise to heal and its potential peril, its inherent ability to cause harm. Understanding that balance and knowing our role in helping to manage it is really at the heart of using medicines safely and wisely.